Now to an update on an exclusive Fox 12 investigation into errors made by one pathologist with Providence Health System. We're hearing from one of the impacted patients who says she's now preparing to take legal action.
She says her biggest frustration isn't the medical error itself, it's the lack of answers coming from Providence. Fox 12 Investigates Ezra Kaplan has a story.
Since first airing this story, we have heard from nearly a dozen women impacted by lab reports that were incorrectly reviewed by one pathologist at Providence Health. The hospital tells us that as part of our routine internal review process, we have discovered some discrepancies in the work of one pathologist. That pathologist is no longer providing services at Providence, but the hospital tells us that they still don't know how many patients may have been impacted. The phone call from her OB/GYN office came out of the blue. It had been a year since Jeri's last exam when they told her there was nothing to worry about.
We're sorry to inform you, but your pathology results, and I gave the date of my last exam, were incorrect, and then went into detail that I'm actually a high-level cervical cancer risk.
Jeri was one of nearly a dozen patients that we know of who had lab results incorrectly read by Dr. Jeffrey Harder, a pathologist at Providence. This is according to interviews and medical records reviewed by the Fox 12 Investigates team. Providence has not publicly identified the doctor in question. We have repeatedly reached out to Harder, but have not been able to reach him for comment. He is no longer providing services at Providence. Jeri asked us to obscure her face and not to share her last name, since she doesn't want her medical information to be public. Until we broadcast this story, Jeri thought she was alone.
Seeing the newscast that there were others out there made me feel selfishly a little bit better, like, okay, it's not just me, I wasn't singled out, but then it also made me so much madder that it was not just me.
Our investigation has found that starting as early as November of last year, Providence began reaching out to patients to inform them of medical errors impacting their health. But for Jeri, there are still more questions than answers.
I'm actually shocked that I haven't received more communication and explanation. They were very quick to jump on me for quality control. I had 6 phone calls within that first phone call, within 2 days, of random different people saying, this is how we can help, this is what we can do, do you have any questions? And then when I had questions, I have no answers.
Like what kind of questions?
I asked if I was the only person. They had no answers for me. I asked if this was a mix-up in results. Did they test the wrong tissue? I was trying to just understand more of what went wrong. They wouldn't answer any of those questions.
A review of patient medical records shared with our team shows that samples initially read by Harder were sent to Stanford Medicine to be reanalyzed. In Jeri's case, a report in her medical file was amended on February 1st of this year from normal to identifying the presence of cells that are known to develop into cancer and which should be removed immediately. She is scheduled for surgery to do just that. But after a year of inaction, there is a risk of finding that the cells have gone from potentially cancerous to actually cancerous.
It wouldn't be hard for somebody to call me and say, you know, we'd like this to stay between us. I would be happy to sign an agreement or something saying I wouldn't talk about it, but at least offer me some human explanation as to what happened. Even if it's completely their fault, then own it. I'm sorry we hired this person. I'm sorry that this happened. Just be honest. I don't understand why everybody has to hide behind everything.
Now, she's talking to a lawyer who says she is one of 3 patients who have already reached out. Jeri says that she isn't interested in making money off a lawsuit, though she expects her medical bills to be covered in full.
I want them to change their procedures. I want them to change how they look at things. Things should be double-checked, triple-checked. This is people's lives.
So it's not really about going after the hospital for money. For you,
it's the whole principle of it. You should be able to trust the medical field. And I don't trust the medical field.
Providence tells us that patients should contact the physician directly to determine what steps to take next, and that they are proactively reaching out to patients who are impacted. The Fox 12 Investigates team is working to speak with a lawyer who is in conversations with several of these patients who have been impacted by these errors. Reporting in studio, I'm Ezra Kaplan, Fox 12 Oregon.